EMR, CPOE prescriptions, eligibility, drug formulary, and patient savings. When you're enrolled with SureScript for e-prescription, one of the additional benefits is that of patient's pharmacy coverage with regards to drug formulary and patient savings information for their specific policies. This is a real-time interface between Prognosis and the SureScripts network. Now, the RX Hub service does have to be enabled with SureScripts by Prognosis for each provider, and this does occur simultaneously when a provider is enrolled for electronic prescription. The interface is executed automatically whenever a patient is marked arrived or an encounter is started manually without an appointment. Queries within this eligibility interface accesses a majority of nationwide payers and pharmacy benefit managers. And for a list of all participants, there is a website here that you can check out based on the SureScript network connections. Now, as for the benefit coverage details, while the interface is executing, the patient data is matched on 5 key elements: the patient's first and last name, date of birth, gender, and postal zip code. Now, if there is a mismatch on any of this data, you can correct the information within Patient Register and then execute the eligibility interface again if you so desire. Coverage details are stored under the prescription or refill screen for easy access. And it's important to note that this eligibility benefit is not necessarily going to be based upon the same insurance that you have entered in Prognosis, compared to what SureScript is accessing in the marketplace through the various pharmacy benefit managers. Now, as regards drug formulary, while you are keying a prescription, if the drug happens to be on a patient's formulary, the alternative drugs will immediately display in a pop-up so that you can change to one of the alternatives if you so desire. If you happen to close the pop-up, the formulary details are also available at any time through the icon on the prescription refill screen. Now, this is a core objective for meaningful use. And then finally, the patient savings details is another benefit of the prescription eligibility program in matters of cost-saving alternatives. 2 primary programs are if you are prescribing a name brand, but there's a generic equivalent available at a lower cost, or if a 30-day long-term prescription is available at a lower cost in 90-day intervals. The screen will display this information as well so that you can adjust the prescription accordingly for your patient. So in our first example, I've logged in here as Dr. Cooper and opened my patient David Cross. I'm going to go ahead and write a prescription for David, but before I do, I want to point out the eligibility button over here on the right. You'll notice the label of the button displays in white font, which indicates the benefit details are present. When an appointment is marked as arrived, or when an encounter is started directly without an appointment, the eligibility is automatically fetched for that patient through the SureScript interface, so that when the provider comes in here to write the prescription, those details are available. Now, you'll notice down here in the formulary status right now it's blank. And that is because the formulary details are actually tied to specific drugs being prescribed. So to demonstrate both of these, I'm going to just go ahead and fill in a prescription for Coumadin. And now that I've updated my prescription, we'll notice that my formulary status has now populated. In this example for the Coumadin, it says that it is on formulary, but it's not preferred. And this particular insurance does not give us the copay and says that coverage info is not present. However, if you notice at the top, we have a pop-up of therapeutic alternatives. So this is an example where the pharmacy benefit manager is returning to us alternative drugs for the one that we're prescribing based on the patient's pharmacy coverage. Now, as regards the eligibility, I'm just going to go ahead and click that button. And we see here that for David, his pharmacy benefits is only for mail order pharmacy. Now, the contents that display on this screen, of course, will vary from one patient to another based on that particular patient's pharmacy coverage, the PBMs that are reporting for claims on that patient, and so on. Now, in this example, we saw the alternatives for the Coumadin automatically displayed. If I had missed it, closed it out by accident, or I just want to look at it again to review it, I have my ellipsis icon here in the formulary status where it displays that data also. So not only will it pop up in the course of writing the prescription, but I can also review it at any time thereafter. And we see the different details here again, which are going to vary from contract to contract with regards to the copay, the coverage, whether it's name brand only, generic brand, NDC codes if you bill for the drugs, and so on. Now in our next example, I'm using the same drug, Coumadin. Notice this time in our patient Jonathan Swift, since he has different coverage, my eligibility has already been fetched, but our formulary is different. This time it says that the Coumadin is on formulary preferred level 1, and it shows the copay as being the tier 1, 2, 3 structure, which is fairly common in a lot of pharmacy policies, but yet coverage info is still not present. So when we go into the formulary info button, we don't have any alternatives listed. We don't have any copayment benefit details. However, notice it says that authorization is required for this drug. Now when I click his eligibility button, notice here we have 3 scenarios. Whereas in our previous example with David, we saw there was just the one scenario. Now the reason there could be multiples, of course, is going to vary from one patient to another. Perhaps the patient has had multiple insurances, or there have been different pharmacies or different pharmacy benefit managers that have processed claims for the patient. In any event, you can look through all of the ones to determine which one is most appropriate. So these 2 examples show how when the benefits are fetched from SureScript, they are specific to a patient and that patient's coverage. In our third example here with Michaela, notice that our eligibility button label is red, and our formulary status is unknown, with coverage info not present. Now the reason for this is because the patient could not be verified during the SureScript interface. So I can still click my eligibility button. Even though the label's red, the button is still populated and is not disabled. And it gives me a reason as to why the benefit information was not obtained. You'll notice at the bottom I have an option to retry. So what you want to do in this scenario is determine the reason the benefits were not found. You see here on the screen there are a few suggestions. Maybe the patient does not have insurance at all, maybe the insurance doesn't have pharmacy benefits, or it could be that there's a mismatch because the name, the date of birth, or the gender do not match. So once you've made the determination, you can then choose to go fix the demographics if that is the situation, hit the retry button, and then it will try to refetch the benefits. And if they are valid, they will be displayed for you. But you also have the opportunity, of course, of verifying if the patient doesn't have insurance, then you can just go on with the prescription and not worry about it. The last scenario we're going to look at here is patient savings details. Now this is an optional benefit that physicians can subscribe to through their SureScript certification in conjunction with being enabled for end-to-end secure messaging. The savings could be either cost or volume related. Based on a patient's pharmacy coverage, the pharmacy benefit managers will inform the physician of equivalent alternatives that can be prescribed, let's say, in a 90-day interval or in a higher volume at a lower cost. And then within this table, the physician can determine a different drug to save the patient money. So when this is applicable for patients who have the benefit, for physicians who have the functionality enabled, the patient savings detail graphic will auto-display in the upper right, similar to how the formulary alternatives auto-display when they are applicable. You see it here in the lime green area. And to view the benefits, you simply click that hyperlink within the green box. And of course, this is going to vary based on the patient as to the content with regards to the drug and the alternative and the benefit. So in our case here of Brendan Porter, we see that there are 3 drugs on his program: the pravastatin, Cymbalta, and atenolol. And with each drug, you see the different cost-saving reason, such as the pravastatin, it's a quantity of 30 for 30 days, the Cymbalta, a quantity of 90 for 90 days, or the atenolol, a quantity of 45 for 90 days. Each drug also has an action box, so the doctor can choose the appropriate action if he does want to choose the alternative, and then click the OK button, and that will update the notification back at the pharmacy benefit manager. Other than that, the prescription aspect of it is the same as with any other prescription. It's just an extension of the eligibility feature within the e-prescription of SureScript. So in review, prescription eligibility and drug formulary is fetched through a real-time interface with the SureScripts network. It does require that your providers be enrolled with the service through Prognosis, which is done simultaneously with setting you up for e-prescribing. The query is executed immediately upon marking the patient arrived, and the interface has access to the majority of all nationwide payers and pharmacy benefit managers within the SureScripts network. Benefit coverage details are determined based upon a 5-key demographic element match. This is not based upon the patient insurance and Prognosis, but rather through the insurance as reported to pharmacy benefit managers from pharmacies for the patient. Mismatches can be corrected and requeried as needed, and the details are always accessible through the prescription screen. Drug Formulary, which is a meaningful use core objective, is also part of the eligibility program, with the data being automatically fetched through the interface with SureScript. When there are alternatives for the drug being prescribed, they will immediately pop up on the screen for the physician to choose the alternate if applicable. And as we saw with the patient savings details, anytime the patient's benefit allows for other alternatives, these will also display in a pop-up on the screen.